Schizoid personality disorder in less than 8 minutes. What do these people have in common? Albert Einstein, Mary Todd Lincoln, Charles Darwin, Sigmund Freud, Stephen Hawking, Bobby Fischer, Karl Marx. Were they brilliant, apathetic, indifferent, remote, solitary, asexual, distant, humorless, or loners? Such is how a schizoid person is usually related to by family and acquaintances. Today, we will explore this fascinating personality trait. Schizoid people, it must be emphasized, are neither psychotic nor narcissistic, nor are they a subtype of schizophrenia. Schizoid people sometimes also get confused with 4 distinct personality types, namely, schizotypical personality disorder, paranoid personality disorder, avoidant personality disorder, and obsessive-compulsive personality disorder. Let's understand first what differentiates them from narcissistic personality disorder. Schizoid people are very self-sufficient. They secretly think that they are the best. They make highly detailed researchers, scientific theorists, philosophers, and novelists. They can process and absorb massive amounts of information, data, and see patterns where the common mind has no clue. But unlike narcissistic people, they are not entitled and are not preoccupied with personal adequacy, power, or vanity. Nor are schizoid personalities psychotic. They are very private and not accessible. They may come across as paranoid, but in reality, they may live in their own very rich and imaginative fantasy world. Unlike schizophrenics, they are not psychotic, do not hallucinate, and have not lost touch with reality. Most notably, schizotypical personality disorder shares multiple salient commonalities with schizoid personality disorder. These 2 disorders are on a continuum with schizophrenia spectrum disorders. This continuum consists of schizoid personality disorder and schizophrenia on opposite poles, with schizotypical falling somewhere in between. Schizotypical can be differentiated from the schizoid type with its more pronounced magical and eccentric thought processes. Unlike the aloofness observed in schizoid, people with paranoid personality disorder are often overly resentful and can demonstrate explosive anger. People with avoidant personality disorder share the trait of social isolation. This isolation precipitates from the fear of rejection, whereas those with schizoid are simply ambivalent towards human contact. Lastly, people with obsessive-compulsive personality disorders may share characteristics like introversion, perfectionism, and neatness, but the obsessive-compulsive types are driven by a necessity to maintain control, and will use the ego defenses of intellectualization and isolation to offset the undesirable emotions. If schizoids are aloof, OCPD types are anxious. Remember, schizoids do not lack emotion, they just cannot express it. The best partner for a schizoid would be a partner who can give lots and lots of space and time alone. Deep down, schizoids crave company, but in their own private terms. In the 5th century BC, Hippocrates, also considered the father of medicine, first put forward his theory of humorism to describe the 4 different types of temperaments. Derivations of this initial theory would be alluded to up until the 20th century till the term schizoid got coined in 1908 by Eugene Bleuler. It is the same brilliant Swiss psychiatrist who would also coin the terms autism and schizophrenia. The first formal attempt to list personality types occurred via the production of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-1, in 1952, which listed 7 personality disturbances. This list was alternately lengthened and condensed over the subsequent 3 editions of DSMs, ultimately precipitating the 10 personality disorders seen in the most recent edition of DSM, the DSM-5. Schizoid personality disorder belongs to a group of conditions called Cluster A, or eccentric personality disorders. Some of the risk factors associated with the condition include childhood sexual abuse, family history of schizophrenia, having cold, distant, and neglectful parents, long-term isolation and loneliness that starts in early childhood, low birth weight, premature birth or prenatal malnutrition, biological markers. While there are not many studies on the link between serotonin and schizoid personality disorder, selective serotonin reuptake inhibitors, which are antidepressants that increase serotonin levels, have been shown to help with some symptoms. Similarly under investigation is the interplay of balance between testosterone, the primary sex hormone in males, and estrogen, the primary hormone in females. Meanwhile, traumatic brain injury or head injury can slightly increase the chance of developing schizoid personality disorder, especially when the impact is around the frontal lobe, limbic system, and parietal lobe, all of which are brain regions that help you feel physical sensations and process your emotions. Let's crunch some numbers now. It affects 0.8% to 3.1% of the general population. Its heritability estimates are about 26% to 29%. There is no difference observed in the frequency between males and females. Some genetic investigations have suggested an association between polymorphism of the 5-HTT-LPR gene and the schizoid trait, and the possible involvement of the adrenergic alpha-2A gene in the disorder. There is paucity of research done regarding neuroimaging and schizoid personality disorders, unlike other personality disorders. Lastly, a word about diagnosis and treatment. Schizoids are least likely to seek diagnosis, let alone treatment, by virtue of their distinct personalities. The usual impetus may be a comorbid condition, or pressure from family, or peers, or a job requirement to take a personality quiz. Whatever may be the reason, if you suspect you have schizoid personality disorder and seek expert help, your primary care provider may refer you to a mental health professional for further evaluation after a physical exam and basic screening to help rule out other medical conditions. Diagnosis of schizoid personality disorder is typically based on a thorough discussion of your symptoms, your medical and personal history, and possible use of personality scales. Treatment options include talk therapy or psychotherapy can be helpful. If you'd like to develop closer relationships, a modified form of cognitive behavioral therapy may help you change the beliefs and behaviors that are problematic. Group therapy can help you interact with others who are also practicing new interpersonal skills. In time, group therapy may also provide a support structure and improve your social skills. Lastly, there's no specific drug to treat schizoid personality disorder. However, certain drugs can help with issues, such as anxiety or depression, and are best administered and monitored by your healthcare provider.